Okay, so we now know that our baby is going to need umbilical lines placed, so we are going to go ahead and get prepared to place those lines. I've grabbed our central line insertion cart. We should always use this cart whenever possible. The other option is to use our emergency cart. So we're making sure the cart was previously locked and cracking that open and gather our supplies. We will need our line placement bag that has all of the items that will go on our sterile field and our umbilical line kit. This is a disposable kit we're using for demonstration purposes. The kit you will most likely use is full of actual surgical supplies that can go back down to sterile processing when done. We will ask our provider what size umbilical lines they would like to put in and take that out as well. And before we open anything, we're going to put on our bouffant and our mask. Everybody in the room will need to be wearing these before we open our sterile supplies. I'm going to take out a bouffant and a mask and a gown and our sterile gloves for our provider as well, so they can put those on when they are ready. Hygiene. And we'll make sure one of our stop signs gets placed on the door so anybody entering the room knows they also need to have the bouffant and the mask on. This is also a good time to clear the room of anybody extra. We don't need anybody that doesn't need to be in the room. One tip when you are inserting lines or assisting with umbilical line insertion and you're using the cart is always keep the cart positioned with the drawers facing you rather than the provider. Once the provider is in a sterile gown and gloves, if they're standing here and working on the baby here and need more supplies, we have to try to figure out how to get in there without contaminating them. So if you have it flipped around facing you and the provider on the opposite side, you can get at the drawers to get additional supplies. So we're ready to open our supplies. I'm going to create a sterile field with our kit. Remember, you always start opening a sterile field away from you. If at any point you notice that you contaminate the field, please do not hesitate to start over. It's wrapped a little. We can't risk having infections on these central lines. All of these items will be placed sterilely onto the field. So this is our umbilical catheter. And it doesn't have to be pretty, just drop it on in a sterile fashion, unless it's taped to your package. And then all of the items from your bag. If your items bounce off the field or onto the floor, just grab a new one from the cart and open it sterilely. You'll notice there are 4 restraints in this bag. These do not go on the sterile field, those will go on our baby. The sterile 2x2s can be tricky to drop onto the sterile field without contaminating them. So what I prefer to do is wait until my provider has their sterile gloves on and is ready for the 2x2s. And then I simply open it sterilely and allow them to grab a corner and remove it and place it on their field. If you want to try to drop them on there, you certainly can. Sometimes the packaging is a little tricky. They're chlorhexidine swabs. Sometimes these are already in the sterile packaging and you won't need to open these. If you do, again, don't drop these onto the field. Wait till the provider's ready for them. Open them and let them grab them sterilely. Don't touch the applicator handles. Just wait until the provider's ready. They will pull them out and use them. And if we come over to our baby, there's a couple things to get the baby ready for insertion. You can see our baby has all of her monitors on already. Make sure that you have nothing under the baby that you won't want on x-ray. So if there's a gel pad, things like that, talk with your provider to make sure that whatever is on the bed is okay for x-ray. Move your patches to the side and stay away from the area that the providers will be working in. You can see this temp probe is too close to the umbilicus, so that would need to be moved off to the side. Diaper is folded down so they can clean as much of the abdomen as they need to, and we have our blood pressure cuff on and ready to go. Once your baby is draped, you will not be able to easily get at these things, so the more you can get done before the baby has the sterile drapes applied, the better. The temp probe is extremely important because once the baby's covered, they can get quite warm under the warmer, and you want this, this reading to be available. And then we'll put our restraints on the baby. I'm not going to put them on her because her arms don't really bend the right way, but you put them on the wrists, making sure that you're not putting them on too tight. You want to make sure your color isn't altered on the fingertips or the toes of the extremities, and then just tie them off to the side in the angle that you would for an x-ray. They don't need to be above the head, or we don't want them right down by the abdomen. Just kind of out to the side is fine. You can tie them to the bed, you can tape them to the bed. Just remember that the sides will need to come down before your provider starts the insertion, so you just don't want them tied to anything that's going to move. And now before we start our procedure, we'll perform a timeout and chart that in our documentation in the medical record.